Good afternoon, my people. Still discussing about the causes of kidney failure. This is a very important topic which majority of people had requested. Causes of kidney failure. We said the most common causes or predisposing factors to kidney failure are high blood pressure and diabetes. We are going to discuss the second cause of kidney failure, which is urine elimination problems. But before we continue, if you are watching this channel for the first time, just take a second or two to subscribe, and don't forget to put the notification bell on so that whenever I produce a video like this, YouTube will automatically notify you and you will never miss any of our content. For the returning subscribers, thank you for keeping faith in me and thank you for supporting this channel. Let's continue sharing so that our videos may reach as many people as possible and that this channel may continue educating you more and more. For those who are appreciating my job, I feel appreciated. Urine elimination problems as the second cause of kidney failure. Urine elimination problems. As the sentence indicates, obviously it means there is a problem in urinating the urine from the body. Remember we said that the urine carries unwanted toxins out of your body. Urine elimination problem. When your body can't eliminate urine, toxins build up and overload the kidneys. This is very important. When your body can't eliminate urine, toxins build up and overload the kidneys. When your body can't eliminate urine, toxins build up and overload the kidneys. Some cancers can block the urine passageways such as prostate, colon, cervical, and bladder cancers. When your body can't eliminate urine, toxins build up and overload the kidneys. Some cancers can block the urine passageways such as prostate cancer, colon cancer, cervical cancer, and bladder cancer. A point to note, other conditions that interfere with urination and possibly lead to kidney failure include the following. Other conditions that interfere with urine or urination and possibly lead to kidney failure include the following. Number 1, kidney stones, enlarged prostate, blood clots within your urinary tract, damage to the nerves that control your bladder. Other conditions that interfere with urination and possibly lead to kidney failure include the following: kidney stones, enlarged prostate, damage to the nerves that control your bladder, blood clots within your urinary tract. Obviously, when there is a blood clot, it will occlude the urine passage or block the urine passage, and this will overload the kidney because there will be no urine flow out of the body. So the toxins will overload the kidneys, and this might lead to kidney failure. Other causes. Other factors that may lead to kidney failure include the following. These are other causes of kidney failure. So, other causes or other factors that may lead to kidney failure include the following. Number 1, blood clot in all around your kidneys. Blood clot in all around your kidneys. Heavy metal poisoning. Heavy metal poisoning. Number 3, drugs and alcohol use. Drugs and alcohol use. Number 4, vasculitis and inflammation of blood vessels. Vasculitis and inflammation of blood vessels. Number 5, lupus, which is an autoimmune disease that can cause inflammation of many body organs. Lupus, which is an autoimmune disease that can cause inflammation of many body organs. Then number 6, glomerulonephritis. Glomerulonephritis, which is an inflammation of small blood vessels of the kidneys. Inflammation of blood vessels of the kidneys. The next point we have hemolytic uremic syndrome. Hemolytic uremic syndrome, which involves breakdown of red blood cells following a bacterial infection, usually in the intestines. Hemolytic uremic syndrome. It involves breakdown of red blood cells following a bacterial infection and usually in the intestines. Next point, multiple myeloma. Multiple myeloma, which is a cancer of plasma cells in your bone marrow. Multiple myeloma is a cancer of plasma cells in your bone marrow. Next point, we have what we call scleroderma. Scleroderma, which is an autoimmune condition that affects skin. Next point, we have thrombocytopenic purpura. Thrombotic thrombocytopenic purpura. Thrombotic thrombocytopenic purpura, which is a disorder that causes blood clots in small vessels. Disorder that causes blood clots in small vessels. Next point, we have chemotherapy drugs. Drug to treat cancer and autoimmune diseases. Chemotherapy drugs, or drugs to treat cancer and autoimmune diseases. Next point, we have dyes used in some imaging tests. Dyes used in some imaging tests. Next point, certain antibiotics. Certain antibiotics. And the last point, we have unmanaged diabetes. Unmanaged diabetes. Let me try to repeat these other causes of kidney failure. Other factors that may lead to kidney failure include the following. Number one, blood clot in all around your kidneys. Number two, heavy metal poisoning. Number three, drugs and alcohol use. Number four, vascularitis and inflammation of the blood vessels. Number six, lupus, which is an autoimmune disease that can cause inflammation of many body organs. Number seven, glomerulonephritis or inflammation of small blood vessels of kidneys. Inflammation of small blood vessels of kidneys. Next point we have hemolytic uremic syndrome. Hemolytic uremic syndrome, which involves breakdown of red blood cells following a bacterial infection, usually of the intestines. Hemolytic uremic syndrome involves breakdown of red blood cells following a bacterial infection, usually in the intestines. Next point we have multiple myeloma. Multiple myeloma, which is a cancer of plasma cells in your bone marrow. Cancer of plasma cells in your bone marrow. Next point we have scleroderma. Scleroderma, which is an autoimmune condition that affects skin. Thrombocytopenic purpura. Thrombocytopenic purpura is a disorder that causes blood clots in small vessels. Disorder that causes blood clots in small vessels. Next we have chemotherapy drugs. Chemotherapy drugs, all drugs to treat cancer and autoimmune diseases. We have dyes used in some imaging tests. Dyes used in some imaging tests. Next we have unmanaged diabetes. Unmanaged diabetes. And the final point we have certain antibiotics. This marks the end of our video today. Thank you for being with me. Thank you for supporting this channel. Be blessed, and I hope this channel is touching a soul somewhere. Let's continue with our next topic tomorrow. Have a lovely day ahead.